everyone. My name is Brittany Baker, and I will be discussing the ethical issues and research surrounding communication. First, I will be addressing the principles of scientific communication. With any type of communication, whether it be written or verbal, the topic that's being discussed should always be clear so that there isn't any miscommunication. The information provided needs to be easily accessible, simple enough that anybody can understand, and it needs to be accurate always. There are different opinions when in regard to the human research, but one thing that everyone seems to agree upon is that no harm should come to anybody in participating in the research study. Research participants have the right to back out and no longer be involved in the research study for whatever reason they seem fit. In regards to ethical issues around communication within research, researchers must be transparent, honest, and completely trustworthy when conducting their study. Participants have to give their full informed consent, which means that they understand and agree with whatever the research study entails and understanding what the risks are that may be involved. When I communicate with patients, families, or other providers, my main goal is to always be respectful, kind, and clear when speaking with them. My patients' health and their comfortability is my number one goal, and I want them to have a full understanding of what's happening with their body and what their options are moving forward. When communicating with their families, it's important to be empathetic and kind when discussing the treatment options and diagnoses of their family member. When someone is going through health issues, it can be a scary time full of a lot of uncertainty, and I want them to know that I am on their side 100%. When speaking with other providers, I like to keep that same respectful language and tone, but also make it clear that as to what my scope of practice is so that there isn't any room for error. When all providers are on the same page and understand everyone's scope of practice, there isn't any confusion as to what your job is or what the responsibilities of others are around you. When writing formal correspondence, it is important to use proper terminology, grammar, and punctuation. And verifying that these things are done correctly will automatically suggest that you have an understanding for written communication. I would also address and sign off using proper names and titles for myself and whoever I am writing to. Thank you so much for watching my video, and I hope this answers any questions that anyone has about ethical issues and research surrounding communication.